managing cataract surgery is becoming an increasingly important part of the progressive optometric practice. Many at this point are managing patients one day after cataract surgery. Although there are a number of factors that will determine the ultimate success of cataract surgery, we really wanted to highlight 3 important factors to consider in the optometric practice to maximize patient outcomes postoperatively. The first is identifying ocular surface disease. Although some individuals will experience symptoms of ocular discomfort, others with ocular surface disease will become complacent with the way their eyes feel. The only symptoms they may experience is blurred vision or fluctuating vision. But for those with significant cataracts, the visual effects from ocular surface disease will be minimal because the decreased visual acuity from the cataracts may be masking it. But after a successful cataract surgery, the optics are now significantly improved, and these patients will be more sensitive to ocular surface issues. Because of this, it's incumbent upon us to identify and treat underlying ocular surface disease prior to referring for cataract surgery. Although this is a huge topic in itself, we would suggest incorporating fluorescein assessment of the ocular surface, along with assessing the eyelids by applying gentle pressure to the lid margin to assess the quality of meibum that's expressed or the lack of expressible meibum. The next thing to consider is an appropriate discussion of expectations after the procedure. For myopes, make sure to demonstrate the effects of full distance correction after the procedure because many have become accustomed to being able to remove their glasses to see up close. Although full distance correction oftentimes seems reasonable, sometimes it's disadvantageous for the low to moderate myope. You should also appropriately educate patients who are multifocal intraocular lens candidates about the available technology. Additionally, you should educate patients for the potential need for refractive correction after the procedure as well. The third factor is to make sure that you are monitoring these individuals over the 3-month postoperative period after the surgery, and also making sure you manage postoperative inflammation appropriately. Make sure to identify ocular surface disease. And certainly make sure to discuss appropriate expectations with your patients. And also follow up appropriately and manage inflammation appropriately as well. Keeping these things in mind will help us appropriately care for our patients and assure the best postoperative outcomes after cataract surgery. We hope that this has been clinically insightful.